Hi, everyone, and welcome to The Balancing Act. I'm Olga Villaverde.
And I'm Montel Williams.
Today, a guide to informed decision-making in early-stage HER2-positive breast cancer. Really good information here, Montel.
Absolutely, absolutely. Plus, we got Ralphie in the house.
I got quite the fishtail for you, and it's delicious.
I love when he cooks.
Oh,
he's so good. And living with and managing psoriasis.
Balancing Act starts right now.
Today, we're going to talk about two diseases that affect millions of people in this country. The first is eczema, and approximately 15 million Americans suffer from it. The other, psoriasis, affecting more than 8 million individuals in the United States. Now, these two diseases can impact both adults and children, and in many cases can make daily life a challenge. Joining me virtually is pharmacist Lori Lonzak, who is here to talk about treatments that are helping people achieve clearer skin. Welcome, Lori. So great to have you.
Hi, Olga. Thanks for having me.
Lori, let's first talk about psoriasis and eczema. They both have similar symptoms. However, they're not the same. So how can you tell them apart?
That's correct, Olga. So both eczema and psoriasis can cause blotches on your skin, and they both cause itching. But eczema causes that intense itch. It can get so bad that you can scratch your skin so much that it can bleed. With eczema, your skin can also be very red, inflamed, as well as maybe even oozy or crusty. Psoriasis can also be itchy, but your skin may also sting or burn. Some people have reported that psoriasis feels like you've got fire ants stinging your skin. Psoriasis can cause red patches too, or even look silvery and scaly. And genetics plays a big role in who gets either psoriasis or eczema.
Where on the body, Lori, do we see these blotches on people who are suffering from this? I mean, I've seen it on elbows, sometimes even on the face. Any other areas?
Yes, Olga, you're correct. A lot of people get patches on their elbows and face. Other common areas are knees, arms, legs, scalp, your cheeks, and even the palms of your hands.
And I know it can really take a toll on someone's life. Many people are constantly covering up. People are staring. I mean, it's just awful. And some people even think that it's contagious. And how ridiculous to even think that.
Absolutely. And to your point, neither psoriasis nor eczema are contagious. And it can take an emotional toll on both teenagers and adults. There is no cure, but several Dermarest products can help provide that immediate symptom relief.
And I love hearing those words, immediate symptom relief. So let's first talk about a relief for eczema.
For eczema, Olga, Dermarest medicated lotion is a great choice. It can provide immediate itch relief and soften dry skin. It's got green tea and safflower extract in it, some natural ingredients. It's fragrance-free. You don't have to worry about it being greasy, and it is dermatologist tested.
Let's turn now to treating psoriasis. What options are there for people suffering from this?
Yes, Olga, for psoriasis, Dermarest Psoriasis Medicated Shampoo Conditioner is a good option. It relieves and helps prevent recurrence of that scalp itching, irritation, the redness, the flaking. It has salicylic acid and also a unique zinc complex that's specially formulated to treat psoriasis, and it is also fragrance-free. The Dermarest shampoo and conditioner also restores moisture back to the hair and skin. Dermarest products are dermatologist tested and also recognized by the National Psoriasis Foundation. And that is important because that NPF seal of recognition medical review panel, this is a group of board certified dermatologists and rheumatologists. They get together and are responsible for ensuring the treatments that they recognize are both safe and effective.
Lori, such great information that provides not only relief, but honestly, just hope for so many people out there.
Absolutely, Olga. And in both eczema and psoriasis, it's important to reduce the underlying inflammation and also find a treatment that can provide you with immediate symptom relief, ensuring that the treatment is both safe and effective.
For our viewers, Lori, who'd like more information, where can they go?
They should go to dermarest.com, Olga.
A pleasure having you, Lori. Thank you so much.
Thank you, Olga.
And if you'd like more information on any of this, you can also go to our website, thebalancingact.com. We'll be right back.
Are you intimidated by the thought of preparing seafood at home? Concerned you might ruin the fish or think it's going to take a lot of time? Well, I'm here today with Mike Soroy from Highline Foods, the makers of Cuisine, to prove that is all just a fishtail. Mike, welcome aboard. Welcome to my kitchen, man.
Thanks for having me.
It's great to have you. Now, listen, I got to be completely honest with you. I am like a borderline pescatarian, right? As much as I love steak and pork and all that goes with it, I probably eat fish 7, 8, 9, 10 meals a week, right? So tell me what's going on here, because I am so super excited, not only for me as a professional chef, but for me as a home cook. Tell me what's going on.
Sure. So this is all about eliminating the fear of cooking seafood at home, right? Because cooking should be fun, right?
You hit the nail on the head, because I think the word fear and seafood runs through so many people's brains because they don't know what fish to get, or if it's fresh, or how to season it, or how long to cook it. Tell me how you solve the problem.
Cuisine is a family of chef-crafted, fully prepared seafood products, and we actually developed it for the restaurant side of our business. So these are proven winners. So now we're bringing it to your local grocery store where everybody can enjoy a restaurant quality seafood meal prepared at home.
Now, so check this out, right? So you've got tilapia, you've got 3 different flavors of salmon going on here right now. Well, which one do I have here? I got the
Sesame teriyaki.
I got the sesame teriyaki. Now, tell me, I mean, the benefits of fish are well known. I mean, tell me all the good things about it.
Yes, so all this fish is certified as sustainably harvested. It's chock full of omega-3 fatty acids, which have been proven to be heart healthy and brain healthy. And it's so easy to cook, anybody can do it.
I mean, so right here, I mean, here's the simple recipe, right? I got a grill pan. I got the fish. I didn't do anything to it. I got the grill pan, a couple of squirts of nonstick spray, and then to that, I'm going to put 1 piece of bok choy, another piece of bok choy. I'm going to go down to that oven. Mike, you want to give me a hand? You want to open that oven up for me? Okay, I'm going to put this up here on the top, and right here down here on the bottom, I've already got a piece of salmon to bok choy that I already put. Now, by not screwing around and having to go through all the prep and all the time that it takes to cut the fish and then decide I'm going to season it, I made the opportunity into my miso broth right here, right? So I've got a crab miso broth with delicious flavors. I've got the fish right here. I'm going to put a little bit of bok choy going on. Right? Look at this, huh? This is how simple this is. Look at you, right? Now, over here, you see this broth? Here's the miso broth. Just some water, miso.
Awesome.
I got some crab flavor going on in here. Some green onions, some fresh cilantro. Wow.
Perfect.
This is great. Now let's just sit this over here for a second. I want to hear more about what's going on. There's a couple of different dishes that we took the liberty of making with you, right? So I've got the salmon right here, right? This is the garlic herb salmon right there.
Right.
Right? And then I made like a Florida niçoise, right? So there's mango, orange segments, hearts of palm. There's some potatoes in here, string beans, greens, a little bit of dressing, squeeze of lemon, olive oil, simple, easy, delicious. Takes 15, 20 minutes to cook, the whole thing ready to go. It takes you more time to cut the mango than it does to cook the fish.
Absolutely, and with all of the products in the line, if you just cook it and put it over your salad of choice, you have the perfect, healthy, light lunch. Nothing could be more simple.
How about this? We've got a salmon BLT, right? So which salmon do we have there?
That's the honey chipotle.
Wow, the honey chipotle salmon. So we got the honey chipotle salmon with the candied bacon, with some sliced tomato, with some fresh greens, with a little bit of tartar sauce, mayo going on over here. Crush the whole thing together, put it in my mouth. I'm so happy. Tilapia, right? Tilapia is a fish that sometimes people don't understand anything about, but this one's sustainable, right?
Absolutely. Yes, everything here is sustainable, whether it's wild caught or farm raised.
So this is a sustainable piece of fish. We've got some zucchini noodle going on over there, a little bruschetta on the top of tomato and fresh basil, olive oil, all mixed together. You've got great flavors. How many are in the whole collection, the whole family?
We have 9 items in the line. Today we've got 3 or 4 of the tops.
And so this is the Panacea garlic herb tilapia, the honey chipotle salmon, the citrus herb rub salmon, and not to forget the teriyaki that we got down here. Speaking of teriyaki down here, let's me and you get to know each other. Now, where do we find this product?
So you can find these at Kroger, Albertsons, Safeway, but what I would recommend is go to cuisine.com and find the location nearest you. And you'll also get a lot of inspiration on recipes and side dishes. There's a lot of information on the website.
And as always, you can visit our website, thebalancingact.com. You gotta remember, this has been a quick bite.
It's delicious.
But chew slowly. Man, that's good.
It's awesome.
The flavor's great, the fish is great. I gotta say, the broth is pretty good too.
Approximately 1 in 8 women in the United States will develop invasive breast cancer in their lifetime, and approximately 20% of these women will have HER2-positive breast cancer. It's a more aggressive form of the disease, known for putting its patients at a higher risk of recurrence. I'm joined by David Rosales, a certified nurse educator with Puma Biotechnology, who'll help us understand the HER2-positive diagnosis, and also Valerie Mitchell. She's a HER2-positive breast cancer survivor. Welcome to both of you.
Thank you so much
Thanks for being
us.
here. David, let me start with you. Can we talk a little bit, or just help us understand what a HER2-positive diagnosis means?
HER2 stands for Human Epidermal Growth Factor Receptor 2. It is a growth-promoting protein receptor found on the surface of all breast cells. In normal breast cells, the HER2 is responsible for cell growth, cell division, and cell repair. Yet in about 20% of breast cancer patients, the HER2 is not working correctly. It's overexpressed and amplified, which means patients like Valerie have a higher chance of this recurring, meaning the cancer coming back. And so this is an aggressive, very aggressive form of breast cancer.
Valerie, let me bring you in. Let's start with the journey. What happened? When were you diagnosed?
So I was diagnosed in April of 2016. I found a 4-centimeter tumor in my armpit, which is roughly the size of a golf ball. It was linked to a 2-centimeter tumor in my breast. It was invasive ductal carcinoma, HER2 positive.
When you heard HER2 positive, did you know what that meant?
Not at all.
No.
No, I just heard breast cancer, and it was a tornado of information. And when I did learn more about HER2 positive, it was scary.
What exactly did you do in terms of treatment? I know there's protocol when you get a breast cancer diagnosis.
I started with chemotherapy, which included trastuzumab, and then I had several surgeries, and I opted for a bilateral mastectomy because I wanted to make sure that I was doing everything to keep this disease from coming back, and I also had reconstruction. And then that followed with a series of radiation. The entire process took about a year. I was also part of a cancer support group, and it was a wonderful experience to have other women to be able to talk to who have been in my shoes and who could help me prepare for what to expect. But it was also scary because I could see women just like myself and even younger than myself whose cancer was coming back. And so it gave me the determination to know that I would do whatever it took, and I needed to stay on top of new developments.
And did you do that?
I did. I finished my treatment in May of 2017, and in July of 2017, I saw information about a new drug that had just received FDA approval, and the medication was Neurolink. I went to my doctor. I was very excited about that, and I took the information and said, "Have you heard about it?" And she said, "I don't want to prescribe it." Thought about it a lot and knew I didn't want to live with any regrets, and so I made a decision to get a second opinion.
David, let me pick up from there. She mentioned Neurolink. How is it used in HER2 positive breast cancer?
Well, Neurolink is indicated, and when I say indicated, that means it's approved for use in early stage HER2 positive breast cancer as extended adjuvant treatment following an adjuvant trastuzumab-based therapy. I know that's a mouthful of clinical terms, but I'm going to explain what that is. Adjuvant therapy refers to additional cancer treatment after surgery. It may be chemotherapy, radiation therapy, hormone therapy, and targeted therapy. Extended adjuvant treatment is extending treatment for a period of time. For Neurolink, it's extending it for 1 year in order to reduce the risk of the cancer coming back. Neurolink demonstrated that it reduces the risk of recurrence in adult patients with HER2-positive breast cancer after treatment with a trastuzumab-based therapy. Most common side effects is diarrhea, but it can be serious. However, a healthcare provider may choose to start a patient at a lower dose for the first 2 weeks and increase to full dose in order to help manage this side effect.
So it's an added treatment, if you will, after what is protocol today.
Correct.
Valerie?
So I was on Neurolink for 1 year. following treatment. So it's been about 4 years since I've been on it, and I'm about 5 years out from my original diagnosis.
And are the tornadoes maybe less today?
Oh, significantly less. It's wonderful.
What would be your message to maybe someone who heard that diagnosis today, knows someone?
I would encourage them to know that they weren't alone, to get connected with other people that maybe could relate to their story. I would encourage them to advocate for themselves and to do their research, that it's okay to ask for a second opinion.
Absolutely. Thank you so much for your time, and thank you for coming in. Good luck to you.
Thank you.
David, thank you so much for the information. I appreciate it as well.
For more information, go to Neurlinks.com.
What is Neurlinks, neratinib tablets? Neurlinks is a prescription medicine used alone to treat adults with early-stage human epidermal growth factor receptor 2. It is not known if Neurlinks is safe and effective in children. Important safety information. Diarrhea. Diarrhea is a common side effect of Neurlinks, but it can also be severe. Diarrhea may lead to loss of too much body salts and fluid, which can cause dehydration. Your healthcare provider will prescribe Neurlinks in one of two ways to help manage diarrhea. Full dose of Neurlinks. Your healthcare provider will prescribe the antidiarrheal medicine loperamide for you during your first 2 months, 56 days, of treatment with Neurlinks, and then as needed. A lower starting dose of Neurlinks. Your healthcare provider will start you on a lower dose of Neurlinks for the first 2 weeks of treatment and then increase you to a full dose Neurlinks regimen. Tell your healthcare provider right away if you develop diarrhea. You may be prescribed loperamide as needed. Always take antidiarrheals exactly as your healthcare provider tells you. Call your healthcare provider right away if you have severe diarrhea or if you have diarrhea along with weakness, dizziness, or fever. Your healthcare provider may change your dose of Neurlinks, temporarily stop, or completely stop Neurlinks if needed to manage your diarrhea. Liver problems. Tell your healthcare provider if you have liver problems. Changes in liver function tests are common with Neurlinks. Your healthcare provider should do blood tests before and during treatment with Neurlinks. Your healthcare provider will stop your treatment if your liver tests show severe problems. Call your healthcare provider right away if you experience tiredness, nausea, vomiting, pain in the right upper stomach area, abdomen, fever, rash, itching, yellowing of your skin or whites of your eyes. Pregnancy. Neurlinks can harm your unborn baby. Female patients should tell their healthcare providers if they are pregnant or plan to become pregnant. They should use effective birth control, contraception, during treatment and for at least 1 month after their last dose of Neurlinks. Male patients with female partners who can become pregnant should use effective birth control during treatment and for 3 months after the last dose of Neurlinks. Breastfeeding. Tell your healthcare provider if you are breastfeeding or plan to breastfeed. It is not known if Neurlinks passes into your breast milk. Do not breastfeed during treatment and for at least 1 month after your last dose of Neurlinks. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. Especially tell your healthcare provider if you take medicines used to decrease stomach acid called proton pump inhibitors, PPIs. You should avoid taking these medicines during treatment with Neurlinks. You should avoid eating products that contain grapefruit during treatment with Neurlinks. The most common side effects of Neurlinks when used alone include diarrhea, nausea, stomach area, abdomen, pain, tiredness, vomiting, rash, dry or inflamed mouth or mouth sores, decreased appetite, muscle spasms, upset stomach, nail problems including color change, dry skin, swelling of your stomach area, nosebleed, weight loss, urinary tract infection. These are not all of the possible side effects of Neurlinks. For more information, ask your healthcare provider. Tell your doctor if you have any side effects that bother you or that does not go away. Call your doctor for medical advice about side effects. You may report side effects to FDA at 1-800-FDA-1088. Please see patient information at Neurlinks.com.
Thanks so much for joining us today.
Remember to head to our Facebook page and our website and follow us on Twitter.
You know what you got to do. You got to stay safe, love that family, viewers, and we'll see you next time.